And now we'll transition to Miss Elisa Vigna, who has been so patient. Thank you. She's a research assistant at the National Center for Suicide Research and Prevention of Mental Ill Health, NASP, at the Karolinska Institute in Sweden. Yes, she's traveled far to be here in Guyana. Elisa Vigna is a research assistant, as I told you. She has a background in psychology and public health. Her main work activity is the data analysis of clinical studies conducted within the European Research Project POTION, which stands for Promoting Social Interaction Through Emotional Body Odors. She also contributes to research and data analysis about the impact of socioeconomic factors on suicide rates at a national and international level. I hope that you enjoy.
Well, thank you very much for thank you very much for the introduction. So I should say that I'm recently new to the field. I've only been working for a year as a research assistant, and a couple of months ago we started this project. So we're basically using WHO data, and we're trying to do something nice with it. And since I'm very much interested in women's mental health, I decided to focus on some aspects of gender equality and the impact on suicide rate. And the presentation today is going to be on some work we'll be doing on the effect of female labor force participation on suicide rates. And I would like also to thank my supervisor, Dr. Hadlaczky and Dr. Carli, who were not here, but they will see this presentation. Okay. So just a bit of background. I think we all heard a lot of information during the past week. So we all know that suicide rate is a major issue. Globally, 1.3% of deaths are from suicide, and this is data from 2019. So we're looking forward to see what the data looks now after the pandemic. And it's the leading cause, it's one of the leading causes among young ages, so 15 to 29. 77% of these suicides occur in low to middle income countries, and suicide rates are generally higher for male than for female. Just to give you a bit of context, I thought I would show you what the data look like in the South, Central, and Caribbean area. So as you can see, Vigna and Suriname and Uruguay. Guyana leading, followed by Suriname, and Uruguay is third. And the thing about Guyana and Uruguay is interesting to see that suicide rates have been increased from 2010. But I'm not sure if culturally we can really the social cultural situation of Guyana and Uruguay can be compared definitely. But it's just to give you an overview of the situation in the area. So suicidal behavior in most parts of the world are patterned by gender. This is what we call the gender paradox. So we know that suicide deaths are higher for men, but females tend to have higher rates of suicidal ideation and attempts. And this is true everywhere. This is the male to female suicide death ratio from 2017 from the WHO. Guyana has quite a high female to male ratio. So here to read this map, basically for every one female death by suicide in Guyana, there are about 60 men that died in 2017. So there are several explanations on why this gender paradox exists, but today and in our project in general, we focus on factors connected to gender roles and gender equality, and in particular to female labor force participation. So in this context, one of the most prominent theories was Émile Durkheim, who was a French sociologist, quite an old one, but it's still very much referred to when it comes to research about female work participation in suicide. Because he wrote a book in 1897, so more than a year ago, about suicide. And his theory is still today regarded as, of course, critically, but
There are different categories of suicide,
yeah, exactly.
like how people actually commit it. Those who commit it when they don't feel that they belong to the society.
Yeah, it looks at different factors,
Mhm.
also religion, for example. But basically what he thinks about gender equality in suicide is that women in the context of in their domestic role are protected against other societal. Sorry, I forgot what I had to say. So yes, suicide rate in women is lower because they're not involved as much as men in the collectivist system, and as such they don't feel this its influence both in both ways. We can be good and bad as much as men. So as women's status escalates and they get out of this domestic environment, so their suicide rates will increase. Of course, there are more recent theories, in particular, the role expansion theory and the convergence theory. So the role expansion theory stating that holding multiple roles in your life is connected to better well-being, better health. And the convergence theory is that difference in health outcomes and suicide are due to different gender roles between men and women. So women can benefit from positive effects of the role expansion, so the first theory, but at the same time they experience the detrimental effect of poor working conditions. So their suicide rates end up going up. And at the same time, male benefit from the abolition of masculinized belief and behaviors, so their suicide goes down, and they end up converging. Of course, there are some criticism, especially to Durkheim theories. One is that we think that it's based on outdated assumption about gender relationships. And also, we know that some previous research have shown that this relationship between gender equality and in particular female participation in labor force and suicide rates is conditioned upon sociocultural context. So when women start engaging in the workforce, it brings a challenge to the traditional values of gender roles. This challenge to the traditional values of gender roles, if it translated in changes in norms and politics, then it can possibly produce beneficial effects in suicide rates, not just for women, but also for men. So my little research basically came at investigating whether changes in female labor force participation can have an impact in changes in suicide rates. And we take into account the moderator effect of the socioeconomic context by using the Human Development Index. which I will say in 2 moments for this speech. To do this analysis, we collected data from the WHO, and we only collected data that have high quality data. Countries with high quality data are countries that provide vital registration to the WHO that is all complete. So they have a complete number of that, but they also the coding of the death does not lead to ill-defined causes of death. So the coding is correct. You should know that globally the availability and quality of the data of suicide is quite poor. Only about 80 countries, which is like 40% of the members of WHO, have good and usable data on suicides, high quality. Other selection criteria for including countries in the study was that we didn't want to have missing data. We took into example the period from 2010 to 2019, and we wanted to have as complete data as possible. So we excluded countries that maybe had like 1 year in which the data was not available. This led to the selection of 55 countries for the analysis, and this is the map of the country included. As you can see, there is quite a problem with over-representation of some regions and under-representation of others. For example, we have basically no countries in Africa, very little in Asia, and we have a big black hole in South America. And unfortunately, we could not include Guyana because the level of completeness of the vital registration is about 80%. So I'm really hoping that this will improve and we might be able to include it later. Yes. What does the color mean? Sorry?
What does the color mean?
Oh no, sorry, no, it doesn't mean anything. It's just different color for different countries. But just the colorful one are the selected one, and the gray one are the ones with the color. Yeah. And also we couldn't include Suriname, although it's a little bit better in terms of completeness, but it's still 88%. So it was not enough. We only included the one that had 100% of completeness. The variables that we collected were age-adjusted suicide rates from the WHO data, and for both gender, male and female, and the Human Development Index, which is a UN index that takes into account life expectancy at birth, education in terms of mean age, mean years of education and expected years of education, and income. Then we had from the Eurostat database the data on female labor force participation. So they count all the female that participate in the labor force that are aged 15 or plus. And of course, we collect this data for all the years from 2010 to 2019. We choose 2010 because in 2010, the way HDI was measured is changed. And 2019 because it was the latest year available. So, but here is where it gets really complicated. But for the period from 2010 to 2019, we took this data for every country, and we calculated the average annual percentage change in terms of female participation and in terms of suicide rates, separated from male and female. Once we did this, I used the HDI from 2019 for every country to create groupings. So I divided the sample into 2 groups.
HDI meaning the Human Development Index?
Yes, human development. Sorry. And the cut in the middle of the 2 groups was 0.85. It was based on previous literature. And then we did a correlation analysis for the 2 groups separated. So what we saw is that a high average annual percentage change increase of female participation produce a higher decrease, annual percentage change decrease of especially male suicide. We only had significant results for males. So what does this mean? Take, for example, from 2010 to 2019, you have an increase, a steady increase in women participation. It is about 1%. 1%, and this is correlated with a steady decrease of male suicide rates of about 2%. But if your annual increase in female participation is around 3% every year, you increase 3%, then your decrease in suicide rates is higher. This was the results of our study. Of course, these are preliminary results. Also, it's worth to say that the data, the results for female is not significant, but it's almost, but it's still negative. So we see a trend that is still negative. These are preliminary analyses. As I say, the project is very, very new. We only started a couple of months ago. I was onboarded very abruptly from my boss. And there are, of course, some limitations. One of the limitations is the sample size. 55 countries are very little, and also we have this problem with the representation of every world region. So I'm trying to find a way to include more countries and have more data. And also the model is quite simple. We only have 3 variables. We just wanted to explore if there was something and if we could move forward from there. But there are other variables that can be included, such as family size, age of paternity, marital status, the country, childcare, policies, the religion. Really, a lot of variables can be included in this model. And also, we didn't look whether this is for all ages. We didn't look whether there are different in different age bands. You can assume that maybe it will be different results for older adults than for younger ones. What the analysis does is basically aggregating the whole data from 2010 to 2019. But another interesting thing that could be done is to look whether changes in female participation have an effect on suicides with some lag effect. So, for example, you have 1 year, a lot of women enter the workforce, a lot of women start working, and this will impact suicides maybe 1 or 2 years later. And we don't know that it might. But this is the research, and thank you for listening. I would like also to acknowledge the collaborators from Columbia University that have helped me put this together. And I'm very curious to hear your opinion, what you think about it, what we could do to make it better, and what is your perspective on this topic and your experience. Thank you very much.
I would like to open the floor for questions. Yeah.
So I did just I was reading a research that was done in China where the women were really worked on engaging the women more into the workforce to lower the suicide rate in the country, and it worked. So I do think it's applicable to all countries, because one of the things we had highlighted on the first day of the conference is the ethnicity of the persons that usually commit suicide. And a lot of them, if you probably look into it, it's the women who are in those groups are usually unemployed or stay at home, housewives, and empowering them would make a big difference to them, especially in in situations where there's a lot of domestic violence, which we have a lot in our country, this would definitely be something that will be applicable to our society. So I commend you for taking it on.
Well, do you have a comment? No, it's just a comment. I think it's a very good point that you made. There are definitely aspects of education from now, especially in countries like Ghana, where you have very variety of people, very and also please bring forward other questions, like for example, the access to what type of work, so we should existing access to what type of work, and also the quality of salaries. There are, definitely, but
I think sometimes the empowering parts of it, where a lot of the women think that they can't do anything else because they don't have anything that they can do. But empowering them by showing them ways of how they can do things. So either bring in an income or just empower themselves as an individual would definitely go a long way.
definitely. Of course, we will change them.
Yeah, I just have a suggestion rather. So did you consider looking at the level of female participation in the workforce and how that impacts suicide? For example, women at the entry level position and women at senior management position. How does that, what impact that has on the suicide rate among females? Because women serving at the senior level, middle management position has not only the responsibilities of the home, but the pressures that come with that kind of position, especially if it's within a male-dominated occupation or organization. So I think that's an important factor to look at in this study.
Absolutely, taking notes. No, but yet we is one of the main problems with female labor force participation is that it takes into account both women that are employed and women that are looking for a job. So yes, the next step is looking first of all at employment rates, and then, as I said, the level of employment.
If I may, have you looked at a particular industry in Guyana? Why she looked at the labor force? Remember, we now have oil and gas. That's part of the extractive industry. And Guyana have always had an extractive industry from the bauxite. We have gold and diamond mining. Yeah, our country is known for that. And from the logs and all of that. What is happening to women in the extractive sectors, and how what is happening to them impacts and leads to suicide? I was privy to do a presentation for the extractive industries with USA. And my presentation highlighted, coming from the Women and Gender Equality Commission in Guyana, how women, when they sojourn into a male-dominated sector, like my sister here mentioned, how they are initiated with abuse, not even having a blind because of the conditions in our extractive industries. We don't have these air conditioned, and of course, unless you're a big one. A simple blind, when you're going to change your clothing, becomes an issue because you have these rough huts where they build up what they call the high moon and stuff like that. That's where you go. There's a lot of sex work and so on. So women who sojourn into the extractive industries to cook, simply to cook, is preyed upon, and people want to push them in to a life of sex work. And if we look at SDG 8, it speaks about decent work and the ILO Convention for Women, that they have a right to go into any industry where males are, women are, wherever, even if it's into the ocean, into the deep blue sea. Women have a right to be able to work in every strata without having to face those forms of abuse. So in this study, I would like for there to be a focus on what happens to women in the extractive industries, and you would be very surprised at what happens. It's very abusive to the point whereby nothing really happens. It's like Chatto's land. It's a different law altogether for women in the extractive industries. I don't have to tell you, we've had so many cases. That's where the heavy amount of trafficking in persons also occur in those industries. So I'd like for the study to zero in on what happens to our women who sojourn into the extractive industries in Guyana. It's a big industry. It has a lot of money, but it has a lot of pitfalls, abuse, and debt. I thank you.
Yes, you need to consider that.
Oh, we have 3 minutes.
You need to consider that in order to empower women and give them better working conditions, it really requires a deep societal change in the way we think about gender roles. And this type of societal change needs to come from foundation, but also needs to be done by the government. So creating and putting laws in place that allow for creating better working conditions for women in every sector, not just majorly. But what I think we can do as a suicide researcher is showing the government that if we have working environments that are more balanced in terms of women and men, or we research on how participation of women in the sector impacts suicides, and so maybe it has an impact, maybe it can improve the overall well-being of the company and everybody that works with it. We have a bit of everything. Then the government can see the benefits of using this kind of strategy and implementing laws to do that.
Because in our country, in one of our mining areas, which is Baramito, there's a high incidence of suicide there among the indigenous Carib peoples. And the repeated governments are aware of the conundrum there. Okay, high incidence of suicide among the Carib peoples in Baramita Region 1, and it's a mining community, which is part of the extractive industry to do that gold and diamond.
May I just quickly answer the 1 minute we have? What is the people or governance over the extractive industry?
The Ministry of Natural Resources.
Thank you.
I just wanted to make one comment. Yeah, I'm not in, I do no longer work with NGOs, I'm mayor of Indian. One of the reasons why I came is because it's a safety students person. It's a lot of the.
I thought I recognized you, Mayor.
Her worship.
Well, one of the things I think we're lacking is that we're not training our local leaders to handle the issue either, nor to identify. We've got to understand that people come to us as local leaders asking for those support. People call you in the middle of the night, but there's nothing you can do and nothing that you know of to do. So I think in the overall planning, we need to allow government needs to understand that those local leaders need to have the same knowledge on the ground, because they might be the first person people meet. So we'll be able to direct, and again, we could be able to make, for example, Linden has opened home for women. So when it's suicide or abuse or whatever, once you call us in the night, all we do is get you out. Then we wait for sunlight to put you on to the right people. So it's about that filtering down to the local level, so we can get that support. Thank you.
Excellent. You asked the question more, the leaders. Here is one. Remember that question?
Yeah.
There she is. Thank you, her work as the mayor.
Time and input, most of all. We will transition. We have one more coffee break set moment.
Well, we're now getting excited about what we're hearing. We're going to.
Continue this at 3 o'clock. I see you in the door. Yeah,
We have something in the dome?
at 3 o'clock.
What's happening in the dome?